These are amazing days that we live in. Think about what's happened just in the last 100 years in our country. We live in a world that is full of dreamers and pioneers and new frontiers. I think back, 100 years ago, of Thomas Edison, for example. He had, I think, 2,000 or 3,000 patents on things like the electric light bulb and the phonograph and the telegram and the telephone, and he even made for Mrs. Edison a electric toaster and iron for ironing clothes. That's really someone who's a visionary. I think of Martin Luther King, and you remember his most famous speech standing on the steps of the Lincoln Memorial saying, "I have a dream." And his dream became more and more a reality for a society that's interested in social reform and justice for all. John F. Kennedy, he had a dream too, and he expressed that openly in 1961 and 62 in speeches talking about, we're going to the moon. In this generation, in the next 10 years, and Neil Armstrong in 1969, we watched Walk on the Moon. We also have seen more recently unbelievable developments in technology, haven't we? So we think about people like Steve Jobs and his dream to have a computer that was like in a suitcase that you could close and carry around. And of course, now we do that on our phones. And so amazing generation that we are experiencing and living in. And in dentistry, we've seen dreamers and pioneers and new frontiers happening all around us. I think back on the times I started back in the 80s, and it was so hard to do aesthetic dentistry, but today we have amazing ceramics. We're working in our practice with robotics now that are treatment planning and placing implants that are guided by the robotics. And as you're so familiar, we even have technology now that helps us treatment plan orthodontic cases pre-restoratively, and we get these amazing outcomes that are very accurate. I want to share with you a new dream that I have. And this dream is called Integrative Dental Medicine. So you're asking, what is that? Well, let me explain this to you. Back in 2012, I am an educator in restorative dentistry, and I was invited to a meeting, the second ever meeting of the American Academy for Oral Systemic Health. It was held at the Cleveland Clinic, and there Dr. Michael Roizen and others like Dr. Caldwell Esselstyn and researchers and scientists and clinicians were talking about how they have understood now that they want to look at the whole person, not just signs, symptoms, and write prescriptions, but look at the whole person. And so they call this integrative medicine. He challenged us, that is Dr. Roizen, at the end of his keynote presentation, he said, I believe dentists should be on the front lines fighting the health crisis that is destroying our nation. And you know, when he said that, it was like a calling. I knew that was what I was supposed to focus on the rest of my career. And if I had a platform of influence in dentistry and in teaching and education, that this should be what I focus on. And so for the last 8 years, I've gone to medical meetings on neurology and Alzheimer's and diabetes, where I was the only dentist in the room with 200-300 physicians and specialists, thinking about how does this apply to dental medicine? How could we incorporate some of these important life-changing information and technology into our practices? Over time, this has evolved into something that I'm just coining as integrative dental medicine. What does that look like in practice? Well, one of the things that I learned that is a key to this is what's all about systemic inflammation. Here, I'm showing you an article from the Mayo newsletter called Buzzed on Inflammation, and saying that inflammation is a new medical buzzword, meaning inflammation is seen as being central in most chronic diseases that we see all around us, killing our friends, neighbors, patients, and family members. And so inflammation is something that we know a lot about in dentistry. Inflammation we're very familiar with. We look at inflammation every day. But do we look at inflammation locally as perhaps a reflection on what's going on throughout the whole body? And so now we're addressing the oral systemic inflammation connection through what's going on in the mouth and how it can affect the whole body. We're looking at the systemic oral inflammation connections, such as diabetes, and how that can relate to periodontal disease and breakdown in the mouth. But also we're seeing a sign of what could be something very important going on in the body. Poor sleep, fragmented sleep can create inflammation through the turn on of sympathetic nervous system response, a fight or flight, we're choking to death here response, and the release of stress hormones. Well, if stress hormones are being released over and over and over again throughout the night and daytime in some cases, that can create inflammation throughout the body. Also, a diet, which is a real problem in our country. A pro-inflammatory diet is the #1 cause of systemic inflammation and accelerated aging and atherosclerosis. So is this an important subject for dentistry? Of course it is. Of course it is. And so let me give you 2 examples as to some of the ways in which we can practically implement these things. Here's one, salivary testing. So we've begun doing salivary testing with our patients to look for oral pathogens, elevated levels of oral pathogens, of which there's only a handful so far that we've identified, that can not only cause inflammation and infection locally in the mouth, but also potentially throughout the body. And so infection, inflammation coming from oral pathogens, identifying in individuals what oral pathogens may be elevated, recognizing now that salivary testing, for example, not only can identify these oral pathogens, but the implications for things that may be going on all through the body that we can now begin to talk about and address with our patients. Some cases we treat these, other cases we may actually be involved in collaboration with our medical colleagues. So this is extremely valuable. But you ask, well, how can you make this a practical part of not only helping patients to be healthy, but also helping our practices to be healthy? So is there a model whereby we can create a healthier practice? Let me show you one example. If we have a case example of a patient with 3 to 5 millimeter pockets, easy bleeding, and early signs of bone loss, if we implement through salivary testing the results and recommendations of that, a non-surgical periodontal program or therapeutic program for that individual, there are a number of steps that we're now going to take that will produce not only better health, but also a return on investment. With the average patient, with just that scenario, which is so common in all of our practices, the return on investment or the production in that would be about $1,700 net. If you did that once a week, that would be about $81,000 a year. If you had one patient a day that you treated non-surgically with minimal periodontal involvement, that could produce well over $300,000 in a year. Significant healthy practice building, healthy patient building procedures. And so I'm very excited about this, and we've seen this implemented in our practice, and it's worked out beautifully. Here's another area that has to do with airway, breathing, and sleep. And so this is an article we were asked to write this past year in Inside Dentistry, the wake-up call about dentistry being involved in screening, testing, and actually treating airway problems. I interviewed these experts both in dentistry and in medicine. One, Dr. Suresh Zagi, in our interview together, talked about how he sees dentists as central caretakers, frontline caretakers in this subject of airway, breathing, and sleep disorders. And so we now are beginning to look at our dental patients also from an airway perspective and whether their airway is open or whether their airway is compromised. We have a number of ways of evaluating and testing and screening this. We have procedures now where we can manage airway problems, but we also are looking into more and more procedures where we can correct airway problems, and we're very excited about it. So my new dream is that we'll begin to look at dentistry, look at oral medicine in connection with complete whole health medicine. And even now in the COVID time, what a beautiful time to look at whole health inflammation and immune system compromise, thinking about our new mantra, which is on a great day, we save a smile, and on an amazing day, we save a life. We want to have feedback like this.
Hello, my name is Alvina Bergman, and Dr. Wilkerson literally saved my life.
Yes, that's what we want to hear on a daily basis. Dentistry's new great frontier, I believe, is integrative dental medicine, which is integrating dentistry and medicine. we do that by having systems and checklists. I've written a book on this. I've identified 3 pillars that we see as connected: inflammation and infection, airway, and sleep disorders, TMD and occlusion, which is our specialty. And so we've got checklists that we work with, and working together with you, working through evaluation, working through treatment procedures. And so I am excited to work together with you to create a new frontier. I want to have us follow in the steps of great pioneers before us, but take this to dentistry. And so my hope and my prayer is that together, let's pioneer the dream of a new and great frontier in dentistry.